for me.
So I want y'all to put that together. Mind your business and run your race. Put those two things together, people. You will get far. And that's a big part to taking care of yourself, because it's true. Comparison is a thief of joy. Sometimes when we take a detour, whether we take it or it was imposed upon us, right? It can be to our benefit,
I agree.
right? And we can pull from every experience. And we're back. This is Dr. Judy Wright here on the Balance to Excellence show. And today I have with me Dr. April Ruffin. Really excited about this conversation. Dr. Ruffin is a board-certified internal medicine physician, and she is dedicated to something that is special to my heart, health literacy and education. She earned her medical degree from Wright State Boonshaw School of Medicine and completed her residency at the University of South Alabama, where she developed a strong passion for healthcare advocacy, also special to my heart. As the founder and CEO of Renee Health LLC, she focuses on enhancing health literacy in underserved communities through targeted education initiatives. Dr. Ruffin is also a speaker and a health coach, and she co-founded Young Debs Incorporated, a nonprofit organization mentoring youth in Baltimore, Maryland, guiding them in their personal and professional growth. In addition to her clinical work, Dr. Ruffin mentors collegiate students and early career professionals in the medical field, empowering the next generation of healthcare leaders. Her commitment to mentorship and leadership development has made her a respected figure in her community, inspiring many with her message of success and purposeful leadership. So we are very excited to learn from Dr. Ruffin and her insight and her experiences and just the way she sees things. So Dr. Ruffin, thank you for coming on today.
Thank you for having me. It's a pleasure.
Is there anything that I missed, Dr. Ruffin?
No, that's pretty much that's a great summary.
Very dynamic. And I'm like, we're gonna keep it but even in that small amount, I was like, whoo, Dr. Ruffin's out here doing it. Right. So Dr. Ruffin, I'd like to know a little bit more, the audience would like to know a little bit more about your journey into medicine.
So I was one of those people where I always had a desire to help people, even as a small child. And I would say that I always enjoyed the sciences. I was always into science, history, but I had a very eclectic childhood. So I was in the performing arts. I loved science and I loved history. And so my life pretty much revolved around those types of things. And growing up, I never saw myself as being, as having limits. I always said that I wanted to do multiple things or various things with my life into adulthood. And so I was very purposeful in developing a plan and goals that actually help fulfill those types of things that I wanted for my life, because I always enjoyed art in the performing aspect, but I also enjoyed science and history. So I said, well, let me develop a life that can encompass those things. And I would say I knew for sure that I wanted to go into medicine after doing some shadowing experiences that I set up myself as an undergrad student. So I actually did not get into medical school the first time I applied. And so I say that for any individual who goes for something and is unsuccessful at the first attempt, or even sometimes the second attempt. But it was in that moment that you really have to ask yourself, in those setbacks, what do I really want to do? And so I did research for a while at Johns Hopkins, and I had wonderful mentors there, both peer mentors and my PI, who was also a mentor. He was an MD PhD, so he was a practicing neurologist. And so he was one of the few people who I interviewed with that was actually open and receptive to my long-term goals of going into medicine. Because I actually got turned down from jobs because I wanted to go into medicine. And they took one look at my resume and they said, oh, well, there's no way you're not going to get into medical school. And so they would not hire me.
Oh, okay.
Yep, they would not hire me.
Okay. So they were like, of course you're gonna get in and you're not gonna be here long.
Right?
Oh, okay, I get it.
I mean, so I was just kind of like, well, then, as a new as a new graduate, you're like, well, I need a job. Like I have to,
Right.
right? I can't
I
see.
bills. I need
I have bills to pay. Like I have things I have to do. I have to, demonstrate, that I'm working towards that goal of medicine because I apply like a lot of students during that time. They apply during between their junior and senior year of college.
Yeah.
Didn't get in, and so I did internship in women's health at National Women's Health Network for a year. So that's where I first actually got a chance to get more into the advocacy role. That was the first time I actually had to lobby. I had never lobbied before. I got a chance to lobby with the Susan G. Komen Foundation and the Breast Cancer Coalition. I got to sit in on those meetings to figure out, okay, well, how do these bigger nonprofits work? How do they move and shake? And what are the things that they do? So those are things that I did to say, okay, well, medicine is what I really think that I want to do after that rejection. So I went for opportunities that would help solidify if it was medicine or other aspects of healthcare,
Yeah.
which I could play a part. And so, I did the interning in DC for a year, and then went on to Hopkins and do research. And it was really during those experiences from undergrad and then those experiences after uh, undergrad that I said, no, I really want to do medicine. Practicing medicine is really what I want to do. And so I did the things I needed to do. I retook my MCAT, the standard things that you need to do to make my application stronger. And for me, it was my MCAT score. So I took that time to build that up. And I had opportunities to shadow with my PI, who was a neurologist. So I took advantage of those opportunities. And his mentorship meant so much because not only did he write a letter of recommendation for me that actually came up in my interviews because it was so strong that his recommendation came up several times in my interviews for medical school, that he also set up mock interviews for me. That no, I had access to things I never had access to when I was applying in my undergraduate studies. And so working in that particular lab and having that type of mentorship and sponsorship not only helped me solidify my decision making, but it was great to have that supportive person who was there to edge you along and say, no, you can do this. No, you don't need to wait. I think your application is strong. These are different things approaches that we can take to help you. And because having the research experience, I knew that I didn't want to do just benchtop research or research in that.
Mhm.
It's interesting, and it definitely forced me to think more abstractly and more critically. So I went from a person who was used to memorizing things to having to think in much more complex ways. And that's one thing
Right.
research helped me with. But there was something missing for me. And so that missing piece was the relationship, because you don't have relationships with,
When you're in the lab,
in the lab.
in the research.
And
Yeah,
so
absolutely.
having good relationships means a lot to me, even if it's a short term thing and you're in the hospital and you're just dealing with me on a day-to-day basis, whether it's for one day or whether it's for 10 days. But I value forming those relationships to help people. And that was the part that was missing for me. And so
Yeah.
I said, I'm just going to go ahead and go for it. And so I did. I bet on me, as I tell people. I went and I bet on me. And I said, I don't think my application is going to get stronger than this. And I went for it. And I said, if I go for it and I fail, it's not that I didn't try and not that I didn't do all the things that I could do. And so that's how I ended up, getting into medicine, just because I created experiences. There weren't a whole lot of things that were handed to me. I didn't come from a family of physicians. No one in my family is in medicine. I'm the first in my family to ever go into medicine. So there was a lot that I had to learn, and that my parents and even family learned along the way in the application process.
Right.
So I didn't
Right.
have those advantages.
So even so, as I'm listening to you, a couple of things are coming up for me, and I think you said one of them, right? So, like, even if something doesn't work at first,
Mm-hmm.
it doesn't mean to stop trying. If that's truly where, and the first thing is to assess if that's truly where your heart is, right? Because sometimes we're doing it because it's expected of us. But if that's
Exactly.
truly where your heart is, um, delay does not have to be denied. And
Yep.
so, the fact, because we're going to go deeper into it, when you brought up that was your first time lobbying when you were working at the Women's Health Center, and that was your first time lobbying, and your first time in advocacy work,
Mm-hmm.
right? Um, Sometimes when we take a detour,
Mm-hmm.
whether we take it or it was imposed upon us, right? Um, it can be to our benefit,
Mm-hmm. I agree.
right? And we can pull from every experience.
Mm-hmm. Yep.
And so, that's one of the things that I got from you. And then also when you said I was sure to create experiences,
Mm-hmm.
right? To start to look for different things that actually could give me some of the tools and some more of the pieces so that I knew you knew when you were going to apply again,
Mm-hmm.
right? It was going to be undeniable,
Mm-hmm.
right? But even before you started doing that, other people saw it because that's why they weren't hiring. That's why they weren't hiring you.
Well, they were hiring me. Job, man.
They saw that movie The Last Dragon.
Mm-hmm.
They saw the glow.
Mm-hmm.
They saw the glow. And they were like, no, we need longevity here. You're gonna be gone.
No.
you know.
No.
And it's not because they could tell you were dynamic. One of the things that I did not, and I love that you said that you showed how well rounded you were, that you had a lot of experiences. And one of the things that I always say is it is rare to find somebody, more often than not, the people who go into medicine were gearing for it all along,
Mm-hmm.
right? So for me, I knew at 8 years old because I was the crazy child that actually liked going to the doctor. We
Mm-hmm.
going to the doctor, yay! Right? Like, that was me, right? But a lot of people, they start gearing toward that even in middle school, high school, and everything that they do is toward that end. And that's why a lot of times their identity is so,
Mm-hmm.
steeped so deep in it because they've been putting all those eggs in that one basket. So the fact that you had so many interests is great to hear, and that you really didn't know until you shadowed somebody in like college is when you said, medicine. Look at that. Think about that. For me, though, I went a route that people were like, "What?" Because I always knew I was going to go into medicine,
Mm-hmm.
which in my time meant you were going to be a biology major, a biochemistry major, a chemistry major, something in that science.
Mm-hmm.
And then I took one class and decided I was going to be a sociology major.
Mm-hmm.
And at first, I didn't know how that was going to imbue.
Mm-hmm.
But it's the study of people and study of community,
Yep.
right? And when I say I loved being a sociology major so much that the sociology professors were trying to convince me to go to grad school for sociology, and I was like, "No, I'm going to med
Cool.
school." Like, no, you should go. You should go to grad school for sociology. And I was like, no, but I am going to take what I've learned and bring this back to how I interact with the community.
Yep.
Um, so everything is, if you allow it to be a learning experience that you can take
It is.
with you, is
It
so
is.
important. And I love hearing all the different things, even the fact that you like performing arts, right? There's a creativity piece that you take into,
Yeah.
you know, when you're a physician and when you're in the medical space, there has to be, I know that medicine's a science, but it's also an art,
Yep, it is.
you know?
Mhm.
So, just great things like hearing that story. There's so many lessons in even how, that journey that you took.
Yep.
And, even down to the fact that you're the first. That's a good amount of us. You're the first
Yeah. And
in medicine.
I had parents that were very supportive along the way because,
Hmm.
I had that idea in my mind, of going into medicine. And as I elevated in my studies, my parents would always say, hey, it's okay if you change your mind. Like, you don't have to do this thing because you thought that you wanted to do it when you were 5 or 8 or 15. So
Hmm.
when I went to high school, I went to now it's very popular with all the STEAM. They call it STEAM now, but the STEAM and STEM programs. But the high school that I went to in Maryland is known for having very strong engineering and sciences. And so I always enjoyed science. Like science and history were my favorite subjects in school. And so even when I went to high school, my parents say, hey, if you end up going to, Baltimore Polytechnic Institute and you fall in love with engineering, that is okay, because they wanted to
That's
make sure
okay.
that I wasn't putting the pressure on myself to do
Right.
something because, like, as you mentioned, because I somehow felt it was expected. But they wanted me to fall into it or fall into whatever it is I wanted to do based upon having a passion and a desire to do that thing. And so that's one thing I can definitely thank my parents for, because I was one of the people that I never felt pressured at any point in my journey of medicine. I never felt pressured to be or to go into a specialty because my family or my parents pressured me into going. However, they could support, and they would ask me, what is it that you need that we can do to support you and what it is that you're wanting to achieve? Because I was a person that put enough pressure on myself. My parents were the ones that had to say, chill out, girl.
Yeah.
Relax, take a breath, because sometimes it would be really hard on myself when it came to a lot of
Hmm.
things that I did. So they were always that voice that said, it's okay to step back. It's okay to take a break. It's okay to have those boundaries. And it was definitely something I appreciated because as you well know, as we get further along, especially once you're an attending, uh, you have to start establishing the type of life and career that you want. And the reason why I say life and career is because I look at practicing medicine as something that I do. Yes, I do think I was called to help people, but I also don't think that we're called to help people at the detriment of ourselves. And that in order for us to be healers, we need to exemplify being healed ourselves. And so I'm so thankful that my parents instilled in me and reiterated along the way of my academic and life journey to take care of myself. Because I noticed that even as a resident, like there were certain things that I did to create little amounts of boundaries that I could within my program and
Hmm.
continue to adopt those things as an attending. Because knowing what the physician suicide rates are, knowing that we have colleagues that don't seek mental health services because they are
That's
fearful
right.
or afraid. And so oftentimes we completely neglect ourselves. And so we're not, as healers, we're not healed and we're not whole. And so I'm thankful for that. I'm thankful for a healers arts program that I participated at Wright State because they were very much into self care and taking care of yourself. Before it became a bigger thing that we see now. But Wright State, I have to give them credit. They were very supportive in terms of making us aware of different services that were available to us as students, to encourage us to utilize those mental health services at any point of our journey while we were there. And then the Healers Art program, one of the aspects of it really focused on the human side of medicine. And it wasn't just the human side when we're taking care of people, but they also talked about the human side of taking care of oneself.
Absolutely. Absolutely. And how taking care of it's almost not even almost, it is like a professional duty, right? So taking care of yourself. But first of all, kudos to the program you were in, because depending on the time people went to med school, it's not that they ever told you to hurt yourself or anything like that, but the underlying current was you are there to care for people.
Mm-hmm.
There was not that underlying current of,
Mm-hmm.
but make sure you
Mm-hmm.
put on your oxygen mask first. At no time did anyone say that to myself and the people I went to medical school with in medical school, right? The only time I heard that was on the plane, right? Put on your oxygen mask first,
Yeah.
right?
Yeah.
And so, when and again, we're going to go into this advocacy piece. When we talk about advocacy, that's one of the things, because I'm very big on talking about self-care and
Mm-hmm.
what self-care is and isn't and what it looks like.
Mm-hmm.
And I always tell people self-advocacy is a form of self-care. You have to make sure you are advocating for yourself. And sometimes you have to advocate for yourself against yourself first, because we tell ourselves all kinds of stuff.
Oh, yes, we do. We talk ourselves out of doing things for us. I have to keep myself in check and say, wait a minute, hold up, wait a minute. Why did I do that? I should never do that.
Right.
Like, I could never do that again.
Right. Right. You have to talk. I tell people, talk nice to yourself now,
Yeah.
but sometimes you got to get a little stern and check yourself,
Mm-hmm.
right? And it takes a level of awareness. So I love that, and I love that they were doing that. So let's talk about Renee Health
Mm-hmm.
and what's your primary goals, like why health literacy. And trust me, I'm going to be sitting here listening like a fangirl, because I love to talk about the importance of health literacy.
Yeah.
So
Yeah.
go.
So I actually founded Renee Health during the pandemic. Uh, and, because I had downtime because I couldn't really do traveling, which was my goal to do as a hospitalist. I was like, oh, I'm going to do all this traveling. Then COVID came. So I said, well, what things can I get to while I have this time? And so I reflected on my experience as a resident in Atlanta and then finishing up in Mobile, Alabama. And being in Alabama taught me a lot about, it's really where I got more exposed to the lack of not only literacy, but health literacy. And so with Alabama, during that time, I think they were like either the fourth or fifth ranked poorest state in the country. It's a state in which they refuse to expand their Medicaid to more citizens. You have the Black Belt along there, which is predominantly, it's known as the Black Belt because of the rich soil, but it also happens to be along an area where you have a large number of those who identify as African American who live along there, and much of it is very rural, and many of them
Mm.
don't have access to care. So they don't have access to primary care physicians,
Mm.
including obstetrics and gynecology. And so from being there and studying there, I got a chance to really understand the people who I was helping to take care of, because I had patients that were traveling sometimes 50, 60 miles to come to our clinic. And so,
That's deep. And anybody that's born in a city knows nothing about that. Like,
yeah,
you were born and raised in a city, you know nothing about that
yeah.
life.
And so for some of those people, you recognize that some of the literature that we had was written on like a third grade level. And so you start to notice that some individuals were having challenges even comprehending very simple instructions. And so you have to get very creative in how you communicated uh, things and instructions to people. And these are individuals, who don't have any type of learning disability per se in terms of like a cognitive
Mm-hmm.
issue. These are individuals who just lacked really, when you get to it, the early childhood education, which then perpetuated into adulthood, to which they're now trying to function as as functional individuals who happen to not be completely literate. And then to break that down into taking care of yourself from a medical standpoint just compounds the complexity of that. And so I wanted to create something that would help individuals understand themselves better from a healthcare perspective. I wanted to create something that people could learn how to effectively advocate for themselves and their loved ones, as well as to help individuals to reduce stress and to develop healthy habits. And so that's when I created Renee Health, because I said, well, I want to take skills that I've learned as a physician, but I want to be able to do those things that you just never have time to do in a 15 or 30-minute office visit.
Right.
And you basically take some of those questions and some of that motivational interviewing and education and say, well, let me take those components and create something that's non-clinical, but still educational and that can help people become a better version, a healthier version of themselves. And so I actually did my first webinars during the pandemic and COVID, with COVID being there and so much misinformation. I said, now's the time. Now is the time to use my expertise to educate people because there was so much misinformation, and the fact that we had African Americans and Black individuals disproportionately affected by the pandemic, and our morbidity and mortality were much higher, that it was time to say, you know what, I'm going to educate anybody, but I specifically wanted to make sure that I was targeting and educating my people,
right?
Because of just statistics and what we know. And we know that typically if something's going to negatively impact society, Black and African American individuals in this country are disproportionately affected much more gravely. And so that's when I actually started my first webinar, my first time as Renee Health educating. And so that included, debunking misinformation about COVID-19, offering and breaking down scientific literature into bite-sized pieces that people could understand in layman's terms, and also educating people about the vaccines, because at that time we had Moderna and Pfizer versus the Johnson and the Prozac, and really taking the time to break that down and giving people an opportunity to ask questions without judgment. No question is a dumb question, because during that time we were terrified, and many people were terrified. Many people had, at least knew at that point somebody, by the time we got to the summer, somebody knew somebody who had COVID. And many of us by June or July knew someone who
had
died
passed
from COVID, from complications from COVID. And so I took that time to educate in those spaces. And from there, I, grew and offered more webinars and other opportunities to, for people to learn and even do some things in a group setting to help take care of themselves.
It's so funny because simultaneously, and it wasn't me that came up with it. It was a previous colleague who was a nurse, who came to myself and another colleague of ours who was a nurse and said, I think we should start a podcast. And the reason for it was because we often spoke about the things we had to do to advocate for our loved ones. And how we had to break it down for them in an understandable way. And we always ended with, but they have us. What about the people who don't have an us?
Exactly.
Right?
Exactly.
And so we started a podcast called Queens on Call, where we would break down pieces, and that happened in 2020, where we would start to break down information on all different types of health topics. Because of that health literacy piece, Dr. Ruffin, when I was a senior resident, one of the things that was big to me to impart to the junior residents was, we're in there for hours, right? We're working we're all, you in there's 3 states when you're a resident. You either pre-call, on-call, post-call. Those are your 3 states, and you're tired through every last one of them. So when call is over and you round and stuff, you just want to go home.
Mm-hmm.
But and that leads to a lot of hurry. But what I used to impart to them and stop them, and I don't know if you used to see this, but it was the writing of the discharge instructions.
Yep.
And they're writing in lingo and even symbols, and you know what I mean?
Yep.
That only means something to us. And I would always remind them the discharge instructions is really for the patient.
Right.
It's for the patient to be able to go home and read it. So your handwriting, at that time we were writing, but your handwriting should look good. The instructions needs to make sense to the patient. That patient may not see their physician for another few days, week, 10 days.
Yep.
It's supposed to make sense to the patient. It shouldn't be a piece of paper they have to wait to bring to their doctor so their doctor can explain it.
Exactly.
Right?
Yep.
And that was part of the literacy piece. And I used to impart to them, please, don't just hand it to them, or don't just have the nurse hand it to them. Explain it to them. Right? Because that's part of the health literacy. And what you just imparted, there's a literacy piece. And definitely, if you have a literacy issue, health literacy is most likely going to be an issue.
Yep.
But never get this twisted. You could be literate and still not
understand. I see it all the time. And it's interesting because sometimes I run into patients who have gotten offended because I'm breaking things down so simply. And it's just like, this is not to insult your intelligence, but this is to ensure that you truly understand what's going on. And then half the time they end up calling back later because they weren't paying attention. Because you have some people who think, well, I'm smart, I have a JD, I can get it. It's like, this is a different language. This is a difference. I'm trying to break it down for you to understand. Because I tell my doctors, explain it to me like I'm an 8-year-old.
I was just about to say, I was like, when I am the patient, for all the people out here listening, okay, when I'm the patient, I want to be the patient.
Yep.
Do not talk to me like I'm treating myself. You're going to treat me like I'm in kindergarten. Explain it to me. Like I'm in kindergarten. Do not assume that I understand what you're saying just because. And that's why sometimes, I'm not even going to lie, Dr. Ruffin, sometimes I go in not saying I'm a doctor because I don't.
I do the same thing. I tell people what I do. And they almost always find out because
we can't help ourselves. We'll miss something that triggers it.
It's like, wait a minute, are you in healthcare or something?
Something, and it'll be this one sentence or something that you say, and they'll pick up on it like, wait a minute.
Healthcare? What is wrong with healthcare? You are no. I'm like, no, I'm a doctor. They're like, I knew it.
Yes.
And I always give myself away, but I'm like, please, like, they're like, well, I feel so bad. I'm explaining to you. I'm like, no. Like,
no, please.
Please. Like,
I don't want to think that hard.
I don't want to think. I want you to tell me as if I'm not a doctor. Explain it to me very simply because I get nervous too.
Right.
That doesn't change.
Right.
To go in one ear, like, wait a minute, did I hear that right? So just break it down for me. You don't have to speak medical lingo.
Exactly.
I'm not going to register because you're talking about me. Yeah.
And when my husband and I had our first child, he was the first one. I said, let me tell you something. I do not care that I'm a doctor. I don't care that I'm a family physician. I don't care that I take care of other children. I want to be this child's mother, not this child's doctor, this child's mother. So the pediatrician is going to explain to me like they take the time to explain to everybody else.
Yep.
Okay, don't treat me like I'm supposed to know everything. We're not doing that.
Yep.
So, absolutely. When you were saying that, I was like, but I want them to explain to me in the broken down layman's terms.
All the way down for me. I mean, I feel like I'm 5. I am not offended at all. Because to me, if you can take something that's complicated and make it very simple, that's mastery.
That is mastery.
That's
It's
mastery.
not easy. It's something I deal with all the time because in the job that I do, we deal with different states. And let me tell you something. Different states, the information you send out to them has to be at different reading levels. Some of them sixth grade reading levels, some of them fifth grade, fourth grade, and even third grade,
Yeah.
depending on the jurisdiction.
Mhm.
So when you have a concept that's up here, you have to figure out how to break it down and get it down to sixth, fifth, fourth, third. That's not easy.
Yeah, it's
And
not.
you're absolutely right. It is mastery if you can do that.
Hmm. And
That's
it's
mastery.
amazing the things that you could get people to understand, you know, and
Yeah.
it's like, oh, you know, this person's non-compliant. It's like, well, why are they non-compliant? And sometimes you find out that they're non-compliant where it's not deliberate. They don't understand.
Hmm.
And many
Right.
people are afraid or even ashamed or embarrassed because they don't understand what the doctor explained, or they don't understand what the nurse reiterated that the doctor said, and then the nurse reiterates. Some people they're embarrassed because they still don't fully
They don't get it.
understand. Yeah,
But it's so funny to me that a lot of people, you know how legal documentation will actually call it its own language. We'll call it legalese, right?
yeah,
Right? And people accept that, but for some reason they feel like they're supposed to understand medicine.
yeah.
Yes, if someone takes the time to break it down to you in an understandable way, because it is not always easy. It has so many twists and turns. It's
Mhm.
not easy to understand.
Yeah. And I'm a very visual person, so like there are things that when you like again, it's like the creativity thing. You're thinking outside the box, and so it's a way to me that's a way of advocating for patients and helping patients to advocate for themselves. Because if you figured out a way to explain something to them that works, then you can explain to the patient, okay, well, when you go to your cardiologist or your nephrologist or whomever else here, let them know, hey, like my doctor did this chart or did this, and I understood it very well. Can you create something like that for me? That's a way
Hmm.
of helping a person to advocate for themselves because once
Right.
you help them, then they can be empowered to then help themselves. And you can say, okay, well, if this worked, then we can use this when you go to your other doctor's appointments to see your other doctors. Because now
Yeah.
you understand how you can get the information, you can share that with the doctor and they're not going to get offended. You can share, hey, this is how I can figure out how to do things and stay on task with the instructions or whatever. So that way the other doctors know, okay, well, for Mr. Smith or Miss Johnson, I have to draw out a picture or something like that.
Yes.
Even a simple, you don't have to be the best artist, like something like a simple little picture
Something
and
simple that you could get them to understand. But the beauty of that though is when a physician, and I didn't realize this for a long time that I had patients that followed me when I would leave one place for miles, taking multiple modes of transportation to get to me, and I could not understand
Mhm.
why. I was in New York City. There's plenty of doctors,
Yeah.
right?
There's no
But
short. Yeah.
that's not what mattered to them.
Hmm.
When a doctor or any healthcare practitioner gives you empowerment
Hmm.
and lets you know you have the right to understand
Correct.
your own healthcare. Matter of fact, you are the CEO.
Hmm.
Okay, you should have a team, and you are the head of your team, and we're to work with you and your team. We're here to work with you.
Yep.
And if someone makes you feel like they're not here to work with you, perhaps you need to change that person. Which is, I get it. It's not always easy depending on where you are,
Yeah. Yeah. It's not always.
right?
Hmm.
It's not always easy, but it's when we as physicians or other healthcare practitioners can give them that ownership,
Hmm.
right? And let them know, you have the right. You have the right
Yep.
to ask questions.
Yep.
You have the right to understand. You have the right to stop me and say, I didn't get it.
Hmm.
Or, could you explain it again? You
Yep.
know, you have the right. You
Yep.
know, I don't understand every language, so I don't expect you to understand medicine right off the bat. You have the
Exactly.
right.
Yep.
You have the right. So are there what is one initiative you've come up with under that you're like super proud of?
One of the things I would say that I'm really proud of would be the informational webinars that I offer. Uh,
Mm-hmm.
and the informational webinars that I offer are typically free. And so um, I tend to choose topics that uh, greatly affect um, marginalized communities. Uh,
Yeah.
and so I create different webinars and give them the space and opportunity to ask questions. And so I'm really proud of that.
Yeah.
I've even gotten requests for certain topics. So I had like the pastor of my church actually said, "Hey, I remember, when we joined, because they joined a couple of my webinars, and it was like, I remember when you did the one on COVID, and then you did, some other ones that we came to, and I really uh, would like to see if you can do something to help our men, like something around men's health." And then she kind of explained, it was something near and dear to her because, she had some male family members that she was trying to help along the way. And they could be a
Yeah.
bit resistant in terms of being receptive for information, care for themselves.
Why would they be resistant? We don't know anything about that. We
I
see
know,
that
right?
all the time.
So he said, "Hey, would you be willing to, when you come up with your webinar series and different things that you do, would you do something on men's health?" So that's what I did. So I came up with something. I think I had me about 20 or 25, 30 men from all across the country. Some were even in the UK and Canada that
Yeah.
and different walks of life. I had family members that shared information with other men that they knew. So I always share information with family, with friends, to the general public. And so there were people that shared information with other people, other women who shared, information about the
That
webinar.
is
So yeah, yeah,
wonderful because
yeah,
seriously, honestly, let's be honest. The people that tend to show up to their appointments, to the clinics, who make the appointments, tend to be women.
yep, that's correct.
When I was doing patient care, the men that would come in for certain things, chest pain,
Mm-hmm.
problems in the genital area because that's
Mm-hmm.
important to them,
Mm-hmm.
or because their significant other made them come.
Yep, yep. And half of
Right?
questions, and the wife is answering all the questions. Like,
All the
yeah, like I think he can tell me if his stomach hurts or something. Like, but I mean, but yeah, I see it all the time. I've seen it.
all
I've seen
time.
it where I'm asking my male patient a question, and he's looking at his wife. I'm like, "Sir, you're like 60
He
years
didn't make
old."
that appointment. She made that appointment. She
Yes.
made that appointment. She wrote the date down on the calendar. She took off from work because she going. She,
I have family members
she,
that do that. I do. I have family members that do that. And when they said, my husband came back and I asked him how the appointment go. Well, it was all right.
it was
Everything.
good.
Well, you tell him about this. You tell me you've been. He said, "Oh no, I didn't." She's like, "Well, you know what? Next time I'm going." She said. So when she went the next time, she said because I have a cousin. She's like, "I have to go to his appointments because if I don't go, he won't tell the doctor all the things that he's got going on." So
Yeah,
it's not until it's like really, really bad that then, it's like, "Oh, well, yeah, I'll say something." But you've been sitting here having these issues for months.
yeah,
So you see it a lot.
yeah,
But I'm really proud of that because it was very, very well received. And then the ones
yeah.
that couldn't make it, that register, I make sure that they get, because I record all the webinars. So I give them the information. And sometimes I even do like handouts and things, something tangible, like a little newsletter format so that
Mm,
it kind of recaps like the big points, the big takeaways for them because everybody learns differently, and so so even though they
yeah,
weren't able to make it, I would get emails and messages and saying, hey, sorry I couldn't make it when it was live, but I listened to it while I was in the car on my way to work, or I listened to it while I was at the gym or whatever. And I learned so much. I didn't even realize all those things I should actually be aware of, or that I should be doing, or that I should be talking to my doctor about. Because, you only have but so
Yeah.
much time in an appointment. And the way that our health system is, it's more of a sick care system than a healthcare system. And so because of that,
I'm going to take a deep cleansing breath as you said that. Say that again.
yeah, we are. We have a sick care system and not a healthcare system. If we had the true healthcare system, we really would have hour visits. Because I mean, to really get
Yes.
to really help people, you really need about an hour. I mean, and
Yes.
follow-ups, can be a bit shorter depending upon what it is. But if I'm doing an established care appointment, sometimes those can take longer than an hour, depending on what they have going on. But I mean, unless you're dealing with a relatively healthy 21-year-old that doesn't have any issues, and even then, by the time you get through family history and other types of history, you can still take up to an hour to actually do the good due diligence that the person deserves. And
Right.
unfortunately, the way our system is designed, we can't always give the care that we know that patients deserve.
Absolutely correct. Absolutely correct. And that can be very, that's very strong for me to say it this way, but when I was practicing, sometimes that's how it felt. It could be soul crushing, and you don't show that to the patients,
Yep.
that you want to have more time with them and you
Mm-hmm.
just don't have that time. It could be
Yep.
soul crushing because you're not getting to dig as deep as you could if you
Yep.
had the time that you needed.
Correct.
And it can lead to you just putting a band-aid on a situation because you don't have time to dig down and find out the real cause,
Correct. Yep.
which oftentimes is right in the history if you had enough time to
Mm-hmm.
do it,
Yep.
you know?
It is.
So you said something way back, and I want to pull that back out because I want to talk a little bit about when you were in medical school. Even in medical school, you started to do things with to take care of yourself and
Mhm.
to put some boundaries in place. And you brought that forth since. So one of the things that I like to ask is, what does balance look like to you, if you even believe in it? And I don't have no problem if you don't, because some
Mhm.
people don't. I do.
I do
Some
too.
people don't. But what does that look like to you to be able to make sure that, as one of our guests said one day, and I loved it when she said like that there's some homeostasis
Mm-hmm.
going on in your life? What kind of things do you do?
Yeah. So the first time I ever experienced a point of being so overwhelmed and stressed and burned out was like my first month of medical school.
Mm.
It was unlike anything I had ever experienced in my life. I didn't know I had the propensity to harness that much stress from studying to be something. I because I had never experienced anything like that before in my life.
Yeah.
And it was actually deleterious to my health,
Mm-hmm.
because within my first month and a half of med school, I think I dropped about 15 pounds. I was, oh yes, I was like, my skin looked almost like ashen.
Mm.
And as a very melanated woman, that's hard to do.
And
Um,
and your skin is beautiful. So I know.
hard to do. That was hard to do. But I did. I mean, like, my clothes were falling off of me. I was not in a good
Mm.
place. I had
15 is a lot of weight to lose in a month and a half.
I mean, like, I was like looking at myself in the mirror, and I'm kind of like, I look like a shell of myself.
Wow.
And and so it was at that point that I knew I could not continue being that version of myself, because I had never seen myself in that state before.
Mm.
And I never really thought
That's real. That's real. Ooh.
And so from that point, I actually sought help. And so I went to Miss Charlotta Taylor. She was in our student affairs office. And, you know, and that day completely changed my life because I left with three mentors, two physician mentors, one peer mentor who was a fourth year. And from that on, not only did they help me create balance among all the chaos, but I was able to get the support. And so that was actually the stepping stone for me establishing some boundaries and some self care for myself. So there were things I initially thought I didn't have time for because I thought I had to study all the time, that I had to take a step back. And at first, it felt like another thing to do, like I was stressed about it. But then once I incorporated it in my schedule, it became something that I needed. So in medical school, I actually went to therapy in medical school for 2 years. My first 2 years in medical school, I went to therapy. And it was the best thing I could have ever done. And it became something that I needed. Like I went from dreading going because I was like, oh, this is an hour I need to be studying, to April, you need this for yourself. This is your time to just let it all out and to work on how to balance all these things. So that was one thing. I also created a circle of support around me. So my two med school besties, till this day, we still keep in touch. You know, we're more like family than friends. And that was really important. So there were things that we would do together. We would break bread together. We studied together. We went on walks together. You know, so that was my big support system. Um, Maintaining my faith was a third thing for me. So I'm a practicing Christian, and so that was something that helped center me because for me, medical school actually strengthened my faith walk. And so my church family was actually extremely important to me and gave me the support that I needed. So I had a church family when I was in medical school in Ohio, in addition to my church family that was back home in Baltimore. And so I actually incorporated aspects of those things into my life. So my therapy, my close friends, um, making sure I was eating well. So, I enjoy cooking. So I made sure that I had my meals prepared. So I made sure I had good meals. Um, I did a lot of walking. So most places I walked everywhere for campus. So even if I took breaks, I would go, and even if it's like a 15 or 20-minute walk, taking a study break, going for a walk. I also established certain boundaries, cutoff boundaries for my study time, because there would be moments in my life where I was doing way too much in school. And so I wasn't giving enough to myself. For in medical school, I set the time for spending time with my church family, spending my own self time in prayer and reflection, um, spending non-study time with close friends, where we would schedule that time to be together, to pour into each other and just relax, vent, whatever it is we needed to do. And then setting time to be supported by my mentors, and having those people support me. So all those things actually helped me start establishing what few boundaries that I could and pouring into myself while in school. And then when I went to residency, many of those things I continued. And as a you have a little bit more flexibility in terms of your schedule. Not a whole lot, but you have a little bit more. I remember one time as a resident, I doubled down on and advocating to get the time to go to my mother's deacon ordination. I said, my mother is being ordained as a deacon. I am going. So I'm letting you know, I will not be here. I have to travel to Baltimore. I get a certain number of days off a month. If you want to give me those 2 days, but I did. And I spoke up. And I know a lot of residents would be like terrified, but I spoke up. I said, this is something that's important to me. This is a once in a lifetime thing. This is a major life event. I should be able to go to my mother's ordination ceremony.
Yeah.
I'm not missing that. And I was like, I wouldn't be here this residency if it wasn't for my mother. So those were things that that's probably one of the first times I actually kind of put my foot down as a resident and saying, I'm going. So how can we work this schedule so that I can attend um, and be there and
Yeah.
support my mom? And
I
so,
mean,
yeah.
the, I, first of all, kudos to you for recognizing it early in
Mm-hmm.
your medical school career before it really got out of hand.
Mm-hmm.
I mean, one could argue that, 15 pounds, but like you picked up on it. You didn't just say, I'm going to push through and just let it, be. You really picked up on it and went to somebody. And I think that is so good because I always talk about the need for support. And I
Mm-hmm.
don't care who you are, you need support. Now, I did not necessarily recognize that so fast, but I did go to the school psychologist. Like, she saw me in her office on a regular basis. And to this day, I always say, Dr. Sakura Dupre gave the best advice every time. She gave to all the medical students.
Mm-hmm.
And she said, because a lot of our stress is us comparing ourselves to others,
Yep.
right?
Mm-hmm.
How much did they finish? Oh, they just said that they went through the stuff twice already, and
Mm-hmm.
I haven't finished once. And her thing was, mind your business,
Mm-hmm.
right?
Mm-hmm.
Mind your business. What's happening with that? Don't worry about what they said they did already,
Mm-hmm.
right? And that was, to this day, I'm like, mind your business, Judy, because sometimes you hear stuff in your ear and you're like, but I'm back. Mind your business.
Mm-hmm.
Mind
Yep.
your business. And that's a big part to taking care of yourself, because it's true. Comparison is a thief of joy,
It is.
and
It
it'll make
was.
you
Mm-hmm.
talk not so nice to yourself sometimes.
Oh yeah.
Uh, so, that became very important. But I had built-in support. I had my family. As a matter of fact, I could walk to my medical school from my family
Oh,
home.
that's a
So
blessing.
I lived at home, during medical school. And then I built a network of people. One of the people that I met in medical school is my best friend today. Like, we live literally 90 driving seconds apart from each other. Like, she moved to be 90 driving seconds away from me.
Mm-hmm.
Okay. Because there's something about that connection
It is.
when in something like the potential war zone that is medical school. So you guys been through it together. You were in the trenches.
Yep.
You understand each other,
Four ways to
Um,
one. Yep.
yes. So that support is very important. But like you said, it's everything that you said. It is the spiritual health. It is the physical health. It is the mental health. It is the relational health. Those relationships that you made sure you made time for, right?
Yep.
Because even when we're very tired,
Mm-hmm.
we're like, man, we could just go to bed. But and you're like, I'm supposed to go out, but I could just go to bed. But the moment you see those people, you're like, whoo, all right, second one. Right? Like,
Because you get like a second life, and you're like, wait,
yes,
like I didn't really know I needed this, and
right.
I mean, like I was very, I had to be very intentional because, like you said, you're comparing yourself, and then sometimes you're like, well, wait a minute, well this hour that I could spend pouring into myself, you could easily work yourself into thinking, oh, I need to study some more for the hour. Knowing full well that additional hour isn't going to make any difference in how much we get in here or how we're going to
Yeah,
do the test. It doesn't, like it really doesn't matter. So you really have to make that time. And so like when I started making that a habit, it became something that I truly needed to give back to myself. And so as I went along, I could see the balance from like first year on to fourth year where it's like, okay, now this is becoming not easy, but it's easier for me to incorporate things that I know that I need for myself and not feel
right.
not feel guilty or bad or while I'm while I'm working out or while I'm going for my walk, I'm not sitting here thinking about the Krebs cycle or whatever, or whatever, So
I just feel like you just cursed at me. She said the Krebs cycle.
get those rate limiting steps,
Right?
but because there'd be moments where it's like I couldn't even focus on trying to decompress because I'm so stressed out about what's hanging back there. But I
Yes.
found that once I made it a habit to say no, if we're not going to think about that, even if it's watching like a idiot television for a half an hour, it's just like whatever you need to do to just decompress and not think about
Yes.
practice questions you need to do. It's like those practice questions are going to be there in an hour. It's not going to matter if I get to it now or after.
Absolutely.
And so adopting those things actually helped me throughout, like residency, studying for boards. So now I'm so fine tuned into it that I know exactly what I need and how I need to do it. It's just like that's just how it is. That's
Yes.
how fine tuned it is.
Yes, because first of all, I hope everybody's listening, right? And if you're still here, please like, comment, share, subscribe. I hope you were listening because these are habits to form. It needs to become like second nature to you. I always tell people if you are practicing your self-care, if you are practicing your stress management, if you're doing and you don't need to be in the midst of stress to practice stress management. Matter of fact, I want you to do it every day
Yeah.
so that when you really truly need it, so
Mm-hmm.
that you're not practicing stress care, like you're not practicing sick care like we do in this
Yep.
country. You're doing some prevention. When you really need it, you don't have to search on what do I need to do. It'll come second nature to you. It's like your toolbox is always beside you. Just pull the
Yep.
tool out.
Yep. And so even now,
So,
like I know it's like, well, you know what? I'm overdue for a massage. I'm sitting here checking my calendar. Say, yup, I sure am. Let me go make that appointment
ma'am,
for my massage. Let me go get
ma'am,
for my mani pedi. Like, you know what? Something's not right. You know what? When's the last time I did? And I was like, oh wait a minute, let me get myself back on track because I can feel it. Like, wait a minute, something's missing in my toolbox. I need to bring that
go
tool out.
go get it.
Go get it.
Go get it. I was proud of myself this past week because for the past like 7, 8 days, I did a facial. I got my nails done. I don't even normally get my nails done, right? Got my nails done, got a massage. I was like, ooh, what you doing?
Experience.
Right? Covering ourselves this week, but it needs to be done. And not to say there won't be sometimes you get deep into a lot of busyness in life,
Yep.
but that's why it is important to look at that calendar, put it down on the calendar, or else we'll forget because there's so much going on in life that I always tell people schedule that. Make sure so that it may come up on you. You be like, oh, I forgot, but you had it. You made that appointment. It's already there waiting for you.
Mm-hmm.
You know, so that's so important. So I'm gonna shift to your mentorship because you took getting mentored and you shifted that to, I'm a mentor. So tell me about Young Debs Incorporated.
Sure, yeah. So, Young Debs Incorporated. So, my mom and I actually established it back in
Yeah.
2002. So, my mom is an educator. She was an educator for over 40 years in the Baltimore City public school system. And so she said,
Given to the
I want
peoples.
to take. I know, right? I said that's a hard job.
Yes.
I said I could play, but my doctor stuff. I said, but whoo, bless you guys. But she said, I want to take something with things I've done before. She's like, I've done, different clubs and she's done different dance clubs and things like that with students. She said, but I want to take something and make it more formal and make it my own thing. Pull into all the things that I typically do with my students and create a formal program, a formal curriculum per se
Yeah.
to help young ladies. And so I was actually a debutante when I was a senior in high school. And so we said, well, why don't we pull some of those components that you usually go through when you're in a debutante program and let's add it and mix it in with other components such as performing arts and cultural activities and let's create something that's unique. And so that's what we did. So I was actually 17 when my mom came to me with this idea. And so we put everything together on paper. And our inauguration class was in 2004. And so we offer mentorship now to young men and women, ages 8 through 18. So we start in third grade and we will actually follow students all the way until they graduate from high school. And we create opportunities for students in which they get one-on-one mentorship. We also expose them to various cultural activities because we like for our students to practice the etiquette that they learn, because our kids actually do etiquette classes. Our instructors actually teach etiquette classes. But we say, we want to expose students to more than just saying, this is what you should do, but give students an opportunity to see what they can be. And so in order to do that, we said, well, let's expand the horizons, because some students they've lived in Baltimore City their entire life. They've never been to the Hippodrome Theater. They've never been to Baltimore Symphony Orchestra. They've never been to the Lyric Opera House. These are key areas in the heart of Baltimore City. And they've never had an opportunity to really delve into the rich artistry and history that the city has to offer.
Yeah.
And so we said,
giving them experiences is what it's all about, so they can feel comfortable wherever they go
and
not feel out of place.
And that's the key. And so for us, we're like, we want young ladies and gentlemen to feel comfortable and confident in any space.
Yeah.
Whether you're at the Orioles game downtown or you get invited to a White House press conference dinner, you are comfortable and you're aware that you belong in any of those spaces. And so when you leave and when you finish high school, you go into college or trade school or the workforce, you are prepared for the world. You're prepared for how to handle setbacks, disappointments. You're prepared for, whatever obstacles may come your way. You know how you have the tools to navigate that and help you to also become a productive individual, but also to be able to pour into someone else and to create futures. And that's
forward.
So we noticed that there were different things that students were lacking in getting access to. And we said, well, let's create that thing. And so that's what we've been doing. And so we've been doing it for over 20 years.
At no point did it occur to me that young Debs was from Debutante. That's fly.
Yeah. And so we used to just be for all young ladies, but then we had young men who were participating in our performing arts outreach program. And they're like, well, we want to do all the other stuff that they do. So we said, okay. And so we just looped them in. They would come to the etiquette classes and they would go to the theater. We've taken them to operas and things. And it was interesting.
Very nice.
Seeing we've taken them to see Handel's Messiah, and they're talk about which songs they liked. I was like, I've never seen some students so enthralled with opera. They were like, oh, this song is my favorite. And so it's something new, something different that they never thought that they would like. We've had one, and I like to talk about this student near and dear to me, Daniel Burston. So he was a kid who went from leaving his book bag almost all the time that we had practices for our plays or etiquette classes or outings to getting a full music scholarship for college. And now he is part of the North Carolina Orchestra, for which he's one of their opera singers with the orchestra. And it's it often says about you planted that seed of what I could be. Because he never thought that he could see that in himself. And he and his mom would say that we planted the seed for him. So to see him go from the shy kid who didn't think he could do, and to needing some shaping to help him organize, to becoming he sung at my wedding.
Oh, that is
North Carolina.
That is beautiful.
Yeah. And he actually created his own opera. and
Oh,
he donated all the proceeds to a particular nonprofit organization for his church. But he gave all the proceeds back to his church because he said the singing started there. But he created his own opera, invited members of the community, and my mom and I were there, front row seats, to enjoy. But it's beautiful to see that level of growth, because the mentorship doesn't just start in adulthood. We need it throughout our entire lives.
throughout your entire lives, but it also doesn't end there. Like these opportunities, the same way you create opportunities for yourself, and then even through medical school, but even before that, this that you built with your mother, you already were creating opportunities for them as well, and it teaches them to continue to create opportunities for themselves as they grow, and that's what we all need to do.
Mm-hmm.
Sometimes I used to think I wasn't creative. I've since realized I'm much more creative than I realized I was. I'm a big DIYer in any way, cooking,
Mm-hmm.
growing stuff, building, you name it, I'll do it. But I didn't think of myself like that. Create, be creative and create opportunities for yourself to learn and to keep learning and to be able to put you in spaces so that you can feel comfortable,
Yep.
meeting new people and expanding, because that also is part of the balance, being able to go out there and spread life, and you
Yep.
may receive but you can also give back. And so that's such a beautiful thing. I love that story. That's a wonderful story.
Yep.
Wonderful story. That just a testament to what you're doing. So we're getting close to the end. um I I truly could speak to you for a long time. But we are getting close to the end. But before we do it, again, I want to remind everybody that's still here. First of all, thank you for still being with us. And if you're still with us and you haven't liked and subscribed yet, what are you waiting for? Let's go. Like, subscribe, share with somebody that that can benefit from this information, whether they're a medical professional or not. There are such pearls in each episode that you can benefit from. So you can listen to wherever you listen to your podcast. You can listen on YouTube, or you can watch us on YouTube as well if you are as visual as Dr. Ruffin and I are. Okay. And with that, I'm going to get to the last two questions.
Mm-hmm.
What do you know now that you wish you knew when you started your career?
I will say, and this is based upon, and it's come full, I fully understand it now. And it was something that was told to me when I was still in that limbo journey of getting into medicine. And that was to run your race. That's the best thing that I recognize that more so now where I am. And it was hard to see and to conceptualize that while I'm like in the race and so worried about who's in lane 5 and who's in lane 3. Because if I'm in lane 2, I have to focus on my race. And so,
Yes.
and it helps keep everything into perspective for me.
So I want y'all to put that together. Mind your business and run your race. Put those two things together, people. You will get far.
You sure will. You sure will. My business pays you.
That is really good. That is really good. And sometimes we don't know what our race is, but just keep going, and
Right.
just keep at a sustainable pace,
And sometimes,
but run your own race. Don't run other people's race.
sometimes you're running, sometimes you're limping.
Yep.
Or crawling.
Yep.
But you still got to run. There've been some, look, I've done all of them. I've crawled. Got back up.
That is so funny. Absolutely. And so my last question before we have you tell how people can get in touch with you. My last question is, has your definition of success evolved over time? And if so, what does it what was it then, and what does it look like to you now?
I would say in the past, and I'll say my younger self, but particularly my 20s, I would say my definition of success was having accomplished all the things I put in the list. That's what my definition of success was.
Just as good.
It was, if I'm being honest with myself, because that's how I measure myself. That's how I measure my worth sometimes. My definition of success now is living a life that inspires others to keep going. And for me, it's about a legacy.
Yeah.
And if someone can look at my life and say, if April can do it, then so can I. And for me, that is the definition of success.
That is excellent. I love that. I love that. Dr. Ruffin, how can people get connected to you?
Sure. Well, they can follow me on I'm on LinkedIn as April Ruffin, my government name. I'm also available via email on my website. So website is reneehealth.org. So that's RENEE health.org. And I'm also on Instagram as well. So it's Renee Health Doc. Which was my handle on Instagram as well. So those are the best ways that they can reach out to me. And if they want to email me, they can email me at info@reneehealth.org as well.
Excellent. And we're going to have all of that down below so that you all can connect with Dr. Ruffin. Reach out to her. She has dynamic things to talk about, dynamic things to say. Do you have a book?
I don't have a book currently, but I've been told I need to start working on one. I've actually started a workbook on specifically around mentorships. I've actually started that, and I offer a training for individuals in mastering leadership through mentorship. So I've actually started putting together an interactive workbook for that, but I have not written a book yet. But
me putting out my 2 cents. I'm just saying.
That's yeah. I've been told that I need to do that. So I feel compelled to get started on that. I'll add it on my list of many things to do.
Right. Not that I should add anything to your plate, but
It's funny. One of my med school besties, Lily, and I, we used to joke in med school and saying that that one day when we become attendings, we're going to write a book. Need to write a book. So I don't know, from your mouth to God's ears. So who knows? That might have been the seed that needed to be planted to remind me about that.
Okay, that's wonderful. All right, so that's it. That's it, you guys. Great things. This is one of those shows that you should listen to. If you were listening now, listen to it again. Great things to learn. Great pearls were dropped. Thank you for being here, and we will see you again soon. Bye for now.